Thank you, Howard. It's a pleasure and an honor to be here today with you. I'm going to pick up where Yves Jeannette left off about an hour ago, talking about Canada, and I want to sort of bring you up to date with the response that the Canadian research community has begun to address the question of what we can do on the research side in dementia in Canada. Here are my disclosures. Not really relevant. And we start off with a general slide that we've already seen numbers, and I don't have to review them, that dementia in Canada is as big a problem as dementia in the UK and the rest of the world. So what are we going to do? Well, we don't have a national clinical program because clinical medicine is provincial matter, but there has been a move to create, as Dr. Jeannette pointed out, a national program on research and prevention. And this is from the CIHR website talking about the dementia research strategy. And this is really being co-led by Yves Jeannette, who spoke earlier, and Tony Phillips from Neuroscience, who's sitting in the corner. And they have been the ones that have really championed this effort, which, as Dr. Jeannette pointed out, has an international component to bring Canada into these international collaborative programs, and the national component, which really is called the Canadian Consortium on Neurodegeneration in Aging. Now, this was a call from CIHR, and the response was largely a single response of the Canadian research community focused on dementia. And it's fairly new. We started out about a year ago. There were over 350 researchers across Canada involved in this, and I'll explain the nature of this and the structure over the next few minutes, so you see the extraordinary effort that we've mounted to try to address the challenge of, can Canada do something in the research field which will put us in the front line and make a real contribution to the lives of people with dementia. This is from our press conference about a year ago at the Jewish General Hospital in Montreal. And this is seen on our website, which should be up here, which is a very nice website, ccna-ccnv.ca. And we can see here, there's Rona Ambrose, Canada's Minister of Health, and there's Mimi Loy-Young, who's sitting here from the Alzheimer's Society, and Ronaldo Batista, who's sitting beside her, and Alain Baudet from the CIHR is hiding back there, and there's me looking quite happy because I don't realize the work that's about to begin. So it was launched with investment from the CIHR, and it wasn't just the Institute of Aging, it was a combination of institutes, because as you may not know, dementia in Indigenous peoples in Canada is 3 times the rate of other people. Aging, neuroscience, circulatory and respiratory health, and Institute of Gender, because as you heard already, this is a women's issue. 7 out of 10 individuals are women. And the set of partners, the Alzheimer's Society of Canada is the biggest partner, but also we have provincial agencies, private foundations, pharma, and even some things like the Alberta Prion Research Institute and the Ontario Brain Institute. So it's a set of partners combining with CIHR to fund this effort. The structure is a budget of about $32 million over 5 years. And what we've done is set up national teams. We made teams that were not one center, but combine expertise in Canada, or areas where the Canadian researchers were already internationally known, and where there was a team that could be established between several research institutes across Canada to cover everything from genetics and basic mechanisms, looking for new proteins, all the way up to the social aspects. I'll go over these in just a moment. Most of the Canadian researchers were involved. There are a few outstanding Canadian scientists, such as Jack Germandas, whom I see sitting in the middle of the room, whose research did not fall into a national team, but in many cases we were able to construct teams to look at the problems. And we think this is going to catalyze the research by combining, getting people out of their silos and working together on topics, supported by platforms I'll talk about in a moment. Our objectives are to accelerate translational research, develop new treatments, create this national network of researchers who are now meeting and talking together with a national research infrastructure, and look at national priorities such as delivery in the rural setting, and Drew Kirk will talk about this in a few minutes, in rural and indigenous communities, and build synergy not just in Alzheimer's but across the various neurodegenerative diseases so that researchers are interacting in getting out of their disease silos as well. The teams, as I said, span basic to health service delivery. Just to talk about one or two, the theme one is looking at basic mechanisms and prevention. There's a team, for example, I'm just using these as examples, a team focused on inflammation as a general mechanism of neurodegenerative disease, looking at animal models and human populations, looking at different measures of inflammation. To what extent does inflammation occur and can it be treated? Then there's a team under Carol Greenwood at U of T that's looking, we heard about the finger study and these prevention studies. We're trying to better define in Canada the interaction between these different factors and how to measure them in order to help us design future Canadian prevention trials. Dr. Kiva-Pelto's study is hugely important, but we think in Canada we will have a role in new prevention studies, but we're trying to define the interactions that we see a little bit better beforehand. In theme 2, we're focused on diagnosis and treatment. Vascular illness, the interaction between vascular disease and cognitive decline has been a big area of emphasis in Canada with great expertise. So we've got one team focused on this. And one thing that's interesting, we've tried to appoint junior researchers and mid-level career researchers to lead the teams. So it's not just the very senior people. For example, Sandra Black and Vladimir Hachinsky are on this team, but Eric Smith, a more junior researcher in Calgary, has taken the lead. Then here's another example, a team focusing on cognitive intervention, which is an area of great development in Canada, in Montreal and Toronto, focused on people with very mild cognitive impairment. Can we intervene with intense cognitive training to slow their cognitive decline? Then the theme 3 focuses on quality of life, and there's a set of teams looking at this, and Alex Mihalaitis will be speaking a little later. We have a team that's looking to see, can we prove that an intensive caregiver support program can prevent caregivers leaving the workforce in Canada? Another team under Howard Bergman is comparing the delivery of dementia care in Quebec, Ontario, and New Brunswick to see is there best practices we can learn at the provincial level. And finally, there's a team focused on rural and indigenous populations run by Deborah Morgan in Saskatchewan and Kristen Jacklin in Northern Ontario, looking at dementia in indigenous populations. We are creating a national cohort of patients in different clinical categories that are listed here. By creating these national cohorts, we will catalyze the ability of Canadian researchers to study basic mechanisms, inflammatory markers, for instance, and also have patients available for clinical trials of new molecules coming out of Canadian laboratories. And one thing we're doing very interesting is you have to decide who you're going to include in your studies. The tendency around the world has been to take the best patients. In ADNI, a very important example in the States, 1 out of 15 Alzheimer's patients gets into the trial. So looking at the best patients has really led us to mainly study patients who are not what we see in the community, where there's a lot of multimorbidity. On the other hand, we could include everybody with neurodegenerative disease, and then it's hard to be sure who you've included. So we've compromised. We've got very broad inclusion criteria. We're accepting people with mixed dementia and multimorbidity, and that way we can study the impact of multiple morbidities on the occurrence of dementia. As Dr. Banerjee pointed out, most of the patients with dementia have many illnesses and they're not pure cases. We have a flow of patients. We do very intensive deep phenotyping. We collect many biosamples, including spinal fluid, we're hoping, MRI, scanning in a standardized protocol, and a national brain donation program is being created so that when these individuals die, we will have a standardized pathological protocol. So this deep phenotyping of the cohorts is really critical. We're going to have patients not only with imaging and neuropsychology, but the biosamples are going to be blood, saliva for proteomics. We're going to try to collect fecal samples for microbiome, genetics in everybody using NeuroX chip, which gives all the SNPs that might be involved in neurodegenerative disease. So we'll have very deep phenotyping of their genetics as well. And we're hoping for a longitudinal follow-up if we can get sufficient funds. All of this is stored in a very sophisticated database called LORIS at McGill University under Alan Evans. And this will enable us to take part in big data initiatives going on internationally in the coming years. So there are important national and international linkages we're building. First, we're linked with the Canadian Longitudinal Study of Aging, so we have a normative control group that we'll be able to look at. We're establishing links, and Howard Feldman's playing a big role in this, with the GAP, the Global Alzheimer's Platform, and the European EPAD. We're trying to create Canada as a partner for a registry and to take part in international clinical studies. And this new emphasis on big data, we've established links with the UK Dementia Platform, and we're looking at these big data initiatives so that our deeply phenotyped subjects will be able to be combined with other groups around the world. So there's been tremendous buy-in from the Canadian research community already on this initiative. We're already on the map nationally and internationally. The funding was planned for 5 years, but we were actually mentioned in the budget speech in 2014 where the government committed to long-term support for CCNA, which we believe will allow renewal into the future. And our goal is to deliver breakthroughs in Canada in terms of diagnosis, treatment, and improvement in quality of life of individuals with various neurodegenerative diseases across Canada. And with that introduction, I'll end there and I'll turn things over to Howard Feldman.